Assalamu alaikum. So in this video, we'll be talking about the C7 nerve root and how to examine the C7 nerve root, and what if there is a lesion or something affecting the C7 nerve root, what would happen for the patient. I am Mohammed Raz, and this is your knowledge platform about the brain, spine, and beyond. So in our two previous videos, we discussed the C5 nerve root and the C6 nerve root. Please go back to the playlist on the channel and watch those videos so that you can gather all the examination of those nerve roots. In this video, we will discuss the C7 nerve root. So as we mentioned in our previous videos, we test three things, as we all know, including motor examination, reflexes, and the sensory examination. And one of the rules that we discussed together before is that there is an overlap of the supply, so it's really difficult to find like a very specific test for one nerve root on its own. So you have to keep that in mind. But we try to test specific muscles and reflexes and sensory examination to reach to the approximate nerve root lesion or nerve root supply. So in the C7 nerve root, as you can see in this picture, we have the motor supply. And the motor supply is mainly, you have to remember that C7 is mainly for extension. So that would include the elbow extension in general and the finger extension. So elbow and finger. But also it includes the wrist flexion. So in terms of the extension, we have the finger extension and the elbow extension, and those both are the elbow extension is supplied by done by the triceps muscle, which is supplied by the radial nerve, and we have the finger extension, which is supplied also by the radial nerve. In terms of the wrist flexion, is mostly supplied by the C7, which goes through the flexor carpi radialis, but also to a lesser degree is supplied by the C8, which is through the flexor carpi ulnaris. So you have to keep in mind that still the wrist flexion is dual supplied by C7 and C8. Okay, so how to test those muscles? As you can see in the picture, in terms of the finger extension, what you need to do is ask the patient to keep their hand kind of straightened, and ask the patient to try to extend their fingers, and you push in that direction, so you see how much weakness they have or the strength that they have. In terms of elbow extension, is easy. Again, the arm has to be relaxed, and ask the patient to extend their elbow, and you oppose that action. In terms of the wrist flexion, which is the last one shown in the picture, as you can see, you ask the patient to flex their wrist, and you try to oppose that direction again, and to test the weakness. So that's in terms of the motor examination. So the second thing to test is the triceps reflex, which is that reflex is one of the reliable ones to test for the C7 function, because it receives main supply from the C7 nerve root, and that's also from the radial nerve. So how to test that? You keep the patient's arm relaxed. That's one of the most important things. And then you test with your hammer on the triceps tendon here. So you feel it and you test it. And what you're looking at is basically the reflex that will happen, but also as the patient is exposed, you have to look into the contraction of the muscle, which is the triceps muscle here. So those are, this is how you do the triceps reflex examination. In terms of the last thing, which is the sensory supply of the C7 is small, and that's mainly to supply the middle finger. The middle finger is, you always remember that C6 is here, C7 is here, and that's C8. But also the C7, although it supplies the middle finger, but it's not entirely reliable, because still the middle finger can receive some supply from C6 and also from C8. So you can't rely on this, or it's not sensitive to rely on this as a test for C7, but we usually use this as the main sensory supply for C7 nerve root. So to summarize as quickly, the motor supply or the motor examination involves the extension group, which is the finger extension and the elbow extension, and you add to that the wrist flexion. But again, keep in mind that the wrist flexion can be supplied by C8 as well. The reflex is mainly triceps, which is reliable, and the sensory is the middle finger, which is not reliable given the supply by C6 and C8. I hope you enjoyed this video. Please leave us a comment below and like those videos so that our content can reach a wider audience. Also follow us on the different social platforms to keep updated about our new courses that are coming soon. And also let us know what kind of content you want to see on the channel. Stay tuned for the next one.